Hi, welcome to Happy Tales. I'm Cheryl Rosenthal, Communications and Education Coordinator here at the Oshkosh Area Humane Society.
And I'm Joni Geiger, Executive Director.
And with us today is Nikki Parker, our Medical Coordinator here at the Oshkosh Area Humane Society. And we're going to be talking about summer fun and summer risks. During the summertime, our pets love to be outside, but there are dangers with being outside, and some of those dangers we think about them for us, but we don't think about them for our pets.
Absolutely.
And some of the things that we're going to be talking about are sunburn, heartworm, fleas and ticks, my absolute favorite, and how we can remove those items from our life or how we can prevent them. So let's start with heartworm. Simply because heartworm, to me, is something that is so easily preventable and very expensive to treat and very dangerous. So, Nikki, can you explain to us a little bit about heartworm?
Sure. Heartworm is transmitted when a mosquito bites a dog who already has heartworm and then goes and bites another dog. So then that mosquito injects the heartworm into that dog.
Okay. So it isn't like they're injecting a worm. What they're doing is they're injecting larvae into the dog, and that progresses through the bloodstream.
Yep. Goes into the heart, and then the larvae mature in the heart, and then they start producing little baby heartworms that get circulated.
Now this is a process, right? This isn't like it happens within 24 to 48 hours.
No.
So a lot of dogs can act perfectly normal, but yet be heartworm positive.
Correct. It can take up to 6 months for it to be detected through a test at a vet clinic.
Okay.
Okay. What are some of the symptoms? You know, if I've never done HeartGuard for my dog or heartworm preventative, what are some symptoms that my dog would exhibit?
Sure. In the stages of heartworm, they can start to show exercise intolerance because their heart is starting to fill up with worms, so it can't pump the blood to the rest of the body. So you'll see your dog start to act a little more lethargic. Also, they can start developing a cough because the worms can migrate to the lungs. They can be a little stiff just from having that in their body. So
I see that we have a little, and we'll do a little close-up of this later. So when those little larvae, and I know there's a fancy word for them, but larvae they're called
microflaria.
Microflaria.
Yeah.
Okay. Those little things are floating around in the blood, and we all know that the blood goes through our lungs, and so then it gets to the heart. And what's so dangerous about the treatment?
What's dangerous about the treatment is what we're doing is we're killing off the worms. So if you think about it, if the heart is full of these little white worms here, and
Which can get up to what size?
A foot long.
A foot long, yeah.
A foot long.
Yeah,
So it's like spaghetti.
They can get very large, yes.
Okay.
So you're killing them off, and they can actually create a clot. So then the heart can't pump correctly, and it could kill the pet. So it's very dangerous once they have it.
So the treatment when it's severe heartworm like that.
Yep.
Is it 3 stages or 2 stages of heartworm?
Yes. Well, I mean, here we see the 2 main stages. We see it real bad, and then just the beginning stages.
Mild.
So mild.
Okay.
Yep.
Okay. So the very severe is treated with.
The very severe is treated with an adulticide injection. So the pet is required to go to a clinic and get an injection that is basically a pesticide. It's going to kill off these worms. And it's painful, and it's very difficult and hard on the pet if you think about what you're injecting into them.
And you also need to keep them very quiet so that they're not over-exercising and causing that clot to
Exactly, because
happen.
if you think about it, if you kill them and then the pet runs around, those worms are going to move more. The clot.
Because the blood's moving faster.
Exactly, the blood's going to be moving faster, and it's going to be very bad for the pet.
So the preventative is as simple as?
As simple as 1 tablet 1 time a month.
Which my pets gobble up like candy.
Exactly, they're beef flavored, so they should eat them.
And cost-wise, for the severe treatment, we're looking at like $1,000 or more.
Yeah, very expensive.
And most of the preventatives that you get.
They're a little cheaper. They range from probably $7 to $20 a month, depending on the size of the pet. But if you buy a whole summer supply or a whole year's supply at a time, it's cheaper that way
Right.
too. So.
And
So
you
it's
know,
a cheap
just like
investment.
Cheryl said, I mean, you know, why not? I mean, why would you want to put your dog or cat at risk? You know, you and I have been in this business a long time,
Right.
and we are definitely seeing a rise in
Right.
heartworm.
Absolutely.
I mean,
We're
we
seeing
didn't
a lot
see it
more
years-
dogs coming in.
We didn't see
with
it years
heartworm.
ago.
And
now,
we should also clarify that this is not just unique to dogs, that cats also can get heartworm.
It's rare in cats, but they can absolutely get it,
So it's
especially
something
especially in areas where people aren't doing the preventative.
Sure.
So then it's more prominent, and it's going to get into the cat population.
So how often, can I just go buy some heartworm preventative and start my dog on it, or what should I do? What do I need to do to get my dog started?
You're going to want to go to your vet, and you're going to want to have a heartworm test. It's a blood test. It only takes a few drops of blood. It's quick and fairly painless, right, for the animal. And then they can prescribe you, or they can give you some heartworm.
Okay, and the
preventative.
heartworm is by weight.
Correct. Yep.
So you need to make sure that you have the
Yeah,
right
you need to
size
have the
for
right size for
weight
the-
of your
yeah.
dog.
and you can do this any time of the year. I mean, I know it's usually people think about spring because mosquitoes are starting, but you can do it in August or any time of the year.
Yeah, and you're going to want to have your pets on a year-round preventative
Right.
because
Exactly.
think about how crazy our climate has been,
Right.
with the weather. So,
good point.
You're going to want to make sure that you keep on top of that. It's definitely easier to prevent it than to take care of it
Now, I'm
afterwards.
sure that there's some of our listeners out there that are going, oh my gosh, mosquitoes, can I get it?
Nope, it is not something that we have to worry about with people.
For humans, but for
yep.
cats and dogs and other animals that are out there
Yep.
can be carriers of
Yes.
heartworm. So mosquitoes can bite a rabbit, well, I don't know.
Yeah.
But it's infected mosquitoes that could
Yeah.
bite your cat or dog
Yeah.
and infect them with that. So the other horrible thing that pets get infected with in the summertime are fleas and ticks.
Yes.
And how do we remove a tick? I think that's a big thing. I'm scared to death of ticks.
Sure. The simplest way to remove a tick would just be a tweezers that you have. You're going to want to grasp the tick close to the body. So the head is actually buried into the body.
Because that's what they bury in,
Yep,
right?
they bury their
Yeah.
head down into there. So you're going to want to grab close to the body, and you're going to want to pull straight out.
So am I grabbing between the body and the head?
Nope, you're going to want to grab the actual head. You'll see it when you part the hair.
Okay.
Maybe use a little water so you can see it better
Okay.
if you have a long-haired pet. And you're just going to grasp real close to the body. It'll be the head, and you're going to want to pull straight out.
Okay.
And
You're
then
not going to pull this way or that way. You're going to pull straight up.
pull
And
straight
don't
out.
twist.
Don't
Just
twist.
try to
Yep.
pull it straight
You don't want to
out.
leave any little pieces of the tick in the animal's body.
Okay.
And what I recommend then is actually putting the tick in a little bit of rubbing alcohol, because that way you're sure that they're real flat. You can't squish them. So
Right.
you're going to want to make sure that you put it in some rubbing alcohol.
Okay. And then is it best to just leave that wound, the place where the tick was, just
Yeah.
observe that for the
Just
next
observe
few
it.
days?
You're going to want to look for any swelling, any redness. You just want to make sure that, that animal didn't have any left in it or isn't getting an infection.
So a lot of the topical treatments, I notice that here we have Frontline as
Yep.
an example. This is a topical treatment that you can put on your pet between the shoulder blades that will prevent fleas and ticks.
Yep.
But I understand with these products, the tick still needs to bite the dog before it
Correct.
dies.
Correct.
So
it's not a repellent.
It's not a repellent.
Yep.
Okay. So is it wise in this area, is there a vaccination for Lyme disease? Because that is what we're worried about our ticks getting, correct?
Yes, yes. Yes, you're going to want to talk to your vet about that. Some
Okay.
are going to carry certain things for Lyme disease and some are not.
And obviously Lyme disease is more prevalent, obviously carried by deer and so on
Yep.
and so forth,
Right.
so more in the northern areas, although we can see it here as well.
Absolutely.
We don't
And
see
I do
it.
have my dogs vaccinated
Right.
for
Yep.
Lyme's disease,
Yep.
simply because we go up north a lot.
Yep, if
and
you're
I
doing a
wanna-
lot of camping or stuff like that, I mean, even if you live near a wooded area, you're going to want to make sure that you talk to your vet about the Lyme vaccination.
Now there's also over-the-counter things that people can purchase through different retail stores and so on and so forth. And and we obviously don't want to discredit any kind of products or anything, but would you not say that from your veterinarian you're probably getting a better product or a safer product?
Absolutely. And some of the stuff that you're purchasing in the department store isn't going to take care of your fleas and your ticks.
Right.
And repel your mosquito. You're going to want to make sure that you you're covered with everything by what you're buying. You're going to want to look at the label.
And I've seen a number of flea collars, and of course, and particularly for cats, and I've seen it sometimes with dogs, but you know, where they're, I mean, you can see where it's actually taking the hair or the fur off of the cat. And people have to remember, this is a poison. This is toxic. And you're asking your cat to wear that, you know, for a long period of time.
Exactly. You get a lot of reactions to those flea collars, and essentially the flea collar only covers the head and neck from fleas. So those fleas are going to migrate to other parts of the body.
Well, and I think it's important to point out, you know, with products like Frontline, and I know there's is Interceptor applied the same way as this?
Interceptor is an oral medication.
Okay. So there's, you know, so the topical, which this is, you know, there's
just one example of it.
One example of several different products out there. You put it on the pet's skin between the shoulder blades, and it's wicked into the upper layers of the skin.
Correct.
And so it's, you know, I'm always very cautious about it, but it is something here again when you weigh the pros and cons. I think that's what everybody has to do, is kind of weigh the pros and the cons of putting these things on their pet. And I would rather, you know, put the preventative on my pet than to think about them getting, you know, Lyme disease or fleas in my house.
Yeah.
And a lot of times fleas, you know, compared to ticks, you know, I'm not okay with fleas, but vacuuming is a good way to get rid of fleas.
Well, and fleas are, you know, anybody who's had a flea infestation, it's a pain in the butt. I mean, it truly is. I mean, you really have to do a lot of things in your household. And of course, it spreads to other pets and so on and so forth. So you're absolutely right. But people need to discuss this with their veterinarian. That's really, really important. So, you know, Nikki, we really appreciate you taking the time today to talk to us.
Thanks for being here.
No problem.
All right.
Thank you.
Thank you.
Okay, Joni, I think the next thing we need to talk about is everybody loves summer, and they love summer because of the sunshine. And everybody wants to go everywhere together and be together, and oftentimes people take their pets with them. And my number one pet peeve when I'm driving around in the summertime is when I see dogs left in cars. I have 3 dogs of my own, and I do not take them with me unless I have someone who can stay in the car with them when I run into the store. People need to realize, even on cool summer days, when it doesn't seem that warm out to us, inside a car in less than 10 minutes, the heat can rise up to 160 degrees. It's like leaving your pet in an oven. And in more than 10 minutes, your dog can suffer a heat stroke, brain damage, they can die.
Or die.
And it's really, you know, no laughing matter.
It truly isn't, and every year this happens. This is a tragedy that happens right here in our city and all over the country, and people are just trying to be nice and take their pet with them.
They love their pet. They want to take them with them and don't often think of, you know, what can happen. And so many times I see windows that are rolled down, you know, about this far.
And they think that's enough.
And they think that that's enough. And so what I've tried to do for myself personally is when it starts to be spring, I try to be more conscious of when I get in my car, what does it feel like in my car? How hot is it in my car? And we have to remember that our dogs have a fur coat that they cannot take off. So they really cannot cool themselves. They pant. But they don't perspire the same way that you and I do. So it really is important. Sometimes the best place to park your dog is at home.
Right at home.
You know, especially when we head into those hot summer months.
And sunburn.
Cats and dogs can get sunburn.
A lot of people don't know that.
Dogs can get sunburn on their nose and on their ears. They can also burn their paw pads. Be aware of when you're taking your dog for a walk. Are you walking your dog at noon? Think about how hot that sidewalk is. Take your shoes off and walk on the hot sidewalk.
Or on blacktop or any of those places.
Any of those things. Black dogs especially. I have a black dog. He never lays in the sun. Never. I always see Brody in the shade. So you really want to be cautious of, you know, be aware of your pet's coat color. That can make all the difference in the world,
even a lighter skinned, short-haired dog
is going to get sunburned.
They're going to get sunburned. If they've got a light skin and that hair doesn't completely cover, I mean, people have to really think about that. Dogs and cats can get sunburned.
So you need to, if you're leaving your pet outside to play or to have some fun in the yard, make sure that there's a shaded area. If you don't have any shade in your yard, maybe, you know, one of those little gazebos
or don't leave them out.
Or an umbrella. I'm talking about if you're going to be out there with them. I'm sitting in the shade.
Yeah,
so I want my
absolutely.
dog to sit in the shade too. So,
Yeah.
so please, please, please be aware of the temperature and how sensitive your pets can be to the temperatures outside.
Absolutely.
So we want to make sure that we don't get any of those calls of pets being left in cars.
Okay, sounds good.
Well, Joni, sometimes we have to give our animals pills.
Yes, we do.
And believe it or not, one of my dogs will not take his heart guard.
That's funny.
So I have to dip it in peanut butter. And so because of that, I thought it would be good to share with our audience
Absolutely.
how to pill a cat and how to pill a dog. And to be our demo kitty today, this is Tux. He's a little bit more than a year old. He is a feisty little boy, and when I mean feisty, I don't mean naughty. He's just all boy, very rambunctious.
Very energetic.
And so one of the first things, if your vet says you need to give your pet a pill every day, sometimes the easiest way to do it is to just give them some wet cat food and stick the pill in there. And hopefully they will take that. Now, not always will that work. So what you're going to have to do is you're going to have to take your cat, and you want to sit them by you, and he's going to wiggle. And I'm going to push him up against
This is
next to
a
me.
solo.
Yep. And he's going to struggle.
Okay. Want me to hold?
Sure.
Okay.
So we're going to have Joni hold him, and I need to switch sides with you because I'm right-handed. And I'm going to take his mouth, and I'm going to open it up, tip his head back, and shove the pill in there. And he swallows it. And he says, that wasn't, and that was a cat treat, by the way. It wasn't a pill. I'm not giving him a, I guess he spit it out.
And then one of the things that we want to do, obviously, is not let him go when he's struggling like
Right.
this, although we don't want anyone getting hurt as well.
Right. You're going to take this? There we go. You're going to tip his head back, shove it in there.
And I got to tell you, this is pretty typical, guys. This is really pretty typical.
There, good
I mean,
boy.
it's not very often that, you know, like a kitty is comfortable with this.
Right.
And then, I don't know about you, but after I pill an animal,
You give him another treat.
I give them a treat. And the reason is because you're trying to make that a more positive
A more
experience.
positive type thing.
Right.
So there's also things like this that you can use. This is a pill, what I call a pill popper. You can put your pill in there, and it crumblies. And again, you get that into the cat's mouth, and you pop it right into their throat,
Right.
and then you want to rub their throat to make
Right.
sure that they swallow. Now, we were trying to show him up on the table.
Right.
I have a way that I do it at home. I'm going to excuse myself and go get him.
And I think it's important to remember that when you're thinking, and you got to give your animal a pill, you really want to do the least invasive first, the least amount of restraint. So honestly, if an animal is going to take it in wet food, that's the way to go.
Right.
I mean, don't try to like struggle and
So I don't know if I'm
force
going to
them.
be able to do this.
Would you
in front
like me
of
to
the
move
camera.
back a little
No,
bit?
we're good. We're good. Scott's going to move.
Okay.
And I do this at home with my cats. I get down on the floor, and I put my cat between my legs. Now, I'm not sitting on my cat. I'm just holding him between my legs. And again, I can tip his head back, open it up, put the pill in there, and you are fast. You are fast.
Well, and I think it's important for Cheryl to show this because, you know, people think, you know, like this is easy.
There we
It's
go.
really not.
There, good
There,
boy.
good kitty.
Good boy. And then we're going to give him another one just so that he can have a treat. And he's having none of it. He wants to be gone, which is natural. And so,
If they can look at the body language now, this kitty is not upset.
Yeah.
He's fine.
yeah. So, but here again, you have to give your pet medicine. And so if you can engage somebody to help you do it, but first of all and foremost, try to give it in food. If they absolutely, and the key is, and maybe we're going to open this can and just demo this. Sometimes what happens, people will give them a large amount of food. So what I like to do is I give them just a little tiny area of food, hide the pill in there, and offer it to the cat. And while the cat is eating that, and I don't know if we can get Tux to come over and do that.
He likes wet food.
There, look at that. Well, he's busy eating his pill. In that small amount of food, I'm going to dish up some additional food. So he's going to eat that smaller amount with the pill inside, knowing that eventually
It's a smart kitty.
he's going to get more over here. So kind of the best of both worlds. But he did eat the...
He did. He ate the treat.
He ate my fake pill,
Right,
which
yep.
was a cat treat, which really isn't any of his favorite
Right.
cat treats. So that's some different ways that you can pill your cat.
Sure.
So now we're going to get a dog and we're going to demonstrate that for you.
Okay, sounds good.
Okay, here we are, Joni. This is Taz. He's a 7-year-old neutered male. Very handsome dog.
Oh, is he handsome. What a beautiful markings.
You can see that he is very food motivated, so we're not going to have any problem having him have a pill. But if you're not sure if your dog, some dogs know when there is a pill inside their food. What I like to do is, this is a little cat treat that I'm using as a demo. I'm going to literally stuff it into the hot dog, and I'm going to make sure that I have my second bullet ready with nothing in it. So I'm going to give him the one with the pill in, and followed quickly by the other hot dog with nothing in it. And he's taken his medication like a real trooper.
Yeah.
And that's the difference between pilling a cat and pilling a dog. Now, if you have a dog that after a few days of being on medication, they all get smart and they go, I'm not taking that, and they turn their head or they do whatever. So what you can do instead is you're going to ask if your dog will sit. I'm going to take his mouth and I'm going to open his mouth and I'm going to stuff the pill right in his. I don't know if anybody could see that.
Yeah. Should we turn around the other way so we can maybe do this here? So you can do it.
Taz.
I think you have to get in front there. There you go.
Can you sit?
Okay.
Sit. I'm going to take a hold of his mouth, open it, put the pill way back. Good boy.
Good boy.
Good boy. Don't be afraid to, it's your dog. Hopefully you're comfortable putting your hand in their mouth. And if it's a hot dog, if it tastes really nummy, and then follow it with something good.
Doesn't he sort of remind you of that bacon commercial?
Bacon.
Bacon.
Yeah. He really likes it.
Yes, he's a very nice boy, and he is available for adoption in case anybody should be looking.
Right.
He is really handsome, and he's got some setter in him for sure.
Yeah, he's got something in him. He's just a really, really nice dog. So just take your time when you have to pill your pet. Try to do it, you wouldn't want to take something yucky tasting. Try to get them to take it in their food first of all. If you can't get them to do it that way, then you're going to have to make sure that they get their medication and put it in their mouth and make sure that they swallow. Okay, now that we've demonstrated giving our pets pills, which isn't always an easy task.
It is not.
There are a couple more things that we want to cover regarding the risks of summer, and one of those is ear mites.
See a lot of ear mites here.
We get a lot of cats in that have ear mites, and ear mites are little bugs that live inside the cat's ear, and if they are not treated, it can actually cause the cat's ear to become deformed, cause damage to their hearing, and their ear actually becomes, I think it's kind of like a cauliflowered ear. It actually causes the ear to turn in, and it's very painful. I mean, imagine having something in your ear all the time.
And itching and itching and itching. And of course we see some severe cases where obviously they're very impacted with the ear mites, and they're red and raw because they've itched so badly that they've got
And this is something that is contagious from cat to cat. Those mites can move from one cat to another.
Right.
It is not something that you can treat over the counter.
Nope.
You need to take your cat to the veterinarian and confirm that it is ear mites, and they'll give you a special medication to put in your cat's ear.
Right.
Again, just like pilling, some cats are going to be more easy than others, but it's usually a liquid, and you just have to put a couple drops in their ear a couple times a day to clear that up.
And it is such tremendous relief for these cats. I mean, because it just like you said, it's so uncomfortable to have to itch like that all the time, and it's very difficult for cats.
And here again, it's a good idea as a pet owner. Occasionally, once a month, look in your cat's ears. Is there is there something red and yucky looking in there? Is it waxy? Whatever. You got to kind of know what does a normal ear look like, and what do ear mites look like. And if your cat's scratching, that's a good sign that something's wrong.
A lot of people do let their animal out their cat in particular in the nicer months, you know, and obviously we advocate keeping your kitty indoors, but we you know, the truth is people still do it, whether it's on a harness or a leash or those types of things. So, but there are a lot of dangers out there for cats. We talked about some today, but also another thing that we see more in the summer months than we do obviously in the winter months is an upper respiratory infection. And why don't you share a little bit about what that is?
Well, upper respiratory infection is the equivalent to you and I having a cold, where cats will get congested, their eyes will be running, their nose will be running, and first the drainage is clear because it's a virus. And then that upper respiratory that virus turns into an infection. And so it's very important, again, to be aware of all those things.
And it's easily spread from cat to cat.
It is easily spread from cat to cat.
And if you let your cat outdoors, and obviously if they come in contact with another cat that has this virus, they're going to get it too. You know, just like a cold is very easy to pass, this is as well.
Well, and you know, truth be told, Joni, cats that are allowed to roam outside cause a lot of problems for indoor cats. They can cause a lot of spraying and territorial marking. So the safest place for our pets is in our home.
Is in our home. Absolutely. Cheryl, before we close today, I just wanted to take just a couple seconds and say hi to my neighbor. Her name is Natalie, and she has a friend named Hannah, and she's our biggest fan. She watches us.
Wonderful.
Yes. I saw her, and she likes the show. She's about 8 years old, and she just really enjoys it. She had a wonderful dog named Spot. That I see frequently when I'm walking my dog. And so I just want to say hi to Natalie and Hannah.
Well, hi, Natalie, and thanks for watching. And until next time, happy tales to you.